Good evening, everyone. Thank you for joining us tonight, where we have this very important conversation about meeting the needs of our growing aging population. So I'm joined here tonight by four very distinguished guests. We're very happy to have them with us. And I'm going to go ahead and start with Dr. Erin Greenstein to go ahead and introduce yourself for us, please.
I'm Erin Greenstein. I am the Associate Dean for Health Professions and Associate Professor in the School of Nursing and Health Professions. My background is in health policy and public health, and I spent a long time teaching and doing research on aging and older adults.
Thank you, Dr. Greenstein. Dr. Thompson, Dr. Christian Thompson.
Thank you. I'm Dr. Christian Thompson in the Department of Kinesiology in the College of Arts and Sciences here at USF. I am also the chair of the Interdisciplinary Committee on Aging and the coordinator of the Gerontology minor here at USF to prepare our students to work with older adults in various capacities. I've been here since 2002 and been a part of a lot of really great initiatives that USF has spearheaded to lead to interaction between undergraduate students, graduate students, and older adults in the community. It's a pleasure to be here.
Thank you so much. And Becky Apollinario.
Hi, my name is Becky Apollinario. I have blue hair and I have a tan sweater on. And I am the Aging and Disability Resource Coordinator at the Institute on Aging, and I'm also the Outreach Supervisor there as well for the community programs. On top of that, I am also the co-chair of the AAPI Community Partnership, and one of my goals in my position is to ensure that seniors and adults with disabilities kind of can age what we call gracefully and independently and stay at home. And that's pretty much it. I actually graduated from the grad program here at USF, and it's great to be back.
We are so glad to have you back. And then Carla Hall.
Hi, I'm Carla Hall, and I'm the Associate Director of Curriculum and Instruction at the Fromm Institute for Lifelong Learning at USF. We are a nonprofit program that is housed at USF, but we have the wonderful benefits of being on a campus. I've been in that position for, well, I should say I've been at the Institute for 23 years and have been so fortunate to see its growth and integration into USF. And I serve on the Interdisciplinary Committee on Aging with Erin and Chris, so I've had a wonderful relationship with them for about 15 years. And I'm so honored to be on this panel. Thank you.
Well, we are so happy to have all four of you on this panel tonight. I just heard the best saying as we were coming over here. Erin, would you explain the t-shirt?
Sure. At another university that I worked at, we had a center on aging, and we had t-shirts that said our center's name, and it said aging, everybody's doing it. And so I love it. I think it's something that I always talk about in my classes, because I think often students and young people in general think about aging as something that happens to older people and not something that they're doing in this moment and in every moment since they've been born.
Well, it gave me a whole new perspective. I've been thinking about it certainly as I've been aging. I come from the other spectrum of being a pediatric nurse, and so I'm really excited to learn because I think a few of the things that you might talk about tonight I might need that information for myself. So we're excited tonight to come and talk about the workforce that is going to be needed to care for our current and future aging population. The World Health Organization defines healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. Under the WHO conceptual construct, there are 4 essential requirements for healthy aging: a change in the way we think about aging in older people, creation of age-friendly environments, alignment of health systems to the needs of older people, and development of systems for long-term care. These 4 requirements have clinical, research, policy, and workforce implications, therefore lending themselves to form the 4 pillars of a new strategic approach to healthy aging. In addition, the Health Resources and Services Administration works to provide education and training to healthcare professionals and supportive care workforces to care for older adults. Specifically, HRSA works to transform clinical training environments into integrated geriatrics and primary care delivery systems that are age-friendly and dementia-friendly, and to improve the care of older adults, including persons living with dementia, by using innovative technology and methods. So I think it's clear that there is certainly a shift, particularly among governmental organizations, in terms of recognizing that we need to start doing some things to change how we approach aging and how we make sure that we're able to provide the needs of a population. So first of all, I would like each of you to just kind of share a little bit about how working with aging populations, sparked your interest and why you've devoted your career or focus in working with this population. So we'll go ahead and start with you, Carla.
So I've always had a fondness for deeper conversations. And I found that with adults, starting with my parents and my grandparents, and I also love education. When I came to USF in, 1997, I got my MFA and I noticed the Fromm Institute right here on campus and all of the older folks at that time, and I just thought, I want to learn from them. That's my source. That's where I'm going to learn from life. And therefore I applied for the Fromm Institute and got the dream job that I've always wanted, which is working with older adults going back to school, learning because they want to learn. And over the years, I've noticed that people become alive when they're engaged in intellectual capacity, social capacity, and I see thriving. I see aging as thriving. And so therefore, that just rings so true with me. Yeah. Thank you.
Thank you. Becky.
So for me, it's funny because I was talking to Dr. Greenstein about this. My training is with toddlers, actually. I was a TK teacher for 4 years while I was in grad school. But I took Dr. Greenstein's class on aging, and one of our assignments was cultural aging in different cultures. And I had Samoa as my project. And it made me realize that a lot of the programs in the United States, they're not culturally competent for the aging populations of different cultures. And that got me thinking, what can I do to ensure that my mother, my aunt, my grandmother can have that culturally competent services or resources that they need to age gracefully. And then I saw Institute on Aging was hiring, and I've been there ever since. I didn't even graduate from here yet, and I started working there. So I've been there for 6 years. And IWA gave me the opportunity to be able to find resources, provide education to the community on cultural competent material to age independently but at home, because I also learned that a lot of the seniors, I say seniors with a grain of salt, adults, older adults want to stay at home, right? And so that's kind of been my mission, to get the resources that they want, but to allow them to stay in their homes independently, but also safely, but also keep that identity from their culture with them. So that's kind of how I ended up where I am. It's been great.
Thank you. Christian.
I've always been a physically active person all through early life, involved with sports and physical activity and exercise, and it kind of was a natural fit for me to go on and study what's now kinesiology, but previously was sort of known as exercise science. And initially the lens that I saw exercise through was that of a young, quite physically active person. It wasn't until I became a graduate student and started working on projects with older adults that an advisor had spearheaded that I started interacting with older adults as research participants, started to see how powerful of an impact an exercise program could have, not on lowering their mile time or improving the amount of weight they could lift, but really on improving the quality of their life, how they could engage with life. And it really gave me a sense of, I guess I needed that drive to do something that I felt as though was more than helping just people that didn't necessarily could do it themselves.
Sure.
And older adults definitely can benefit from guidance, especially what we're learning about the powerful effect of different types of exercise on outcomes with older adults. And it's allowed me to get involved with projects both in the community setting, on campus with the Fromm Institute, and collaborating with other really great institutions in the Bay Area and beyond. So every day that I come to work, I get to spend time with my young students, basically my undergraduates at USF, and also with my older students and older colleagues with the projects I'm involved with. So it's tremendously gratifying.
It's wonderful. Erin.
Okay, so I think similar to Carla, it's from my background in childhood. I grew up with really fantastic grandparents and great aunts and great uncles. I lived with some of my grandparents at different times, and they were just these, amazing people who provided me with lots of love and joy and stability, and they knew lots of things, and the older people in my family told me the stories that my mom would never tell me, and it was all like they were just like fountains of information and knowledge and fun and humor. And so I always loved older people. I felt like they were, older people were the sources of all kinds of good things. And so it just made sense to me, as a population, that I would be interested in studying this. And then when I was in grad school, I happened to have the opportunity to teach a year-long class on aging, and I jumped at it. I said, yes, if I could do this, I want to do this, and I haven't looked back since.
One of the things I noticed in each of your stories is that it was a very positive representation of aging. But yet when we look at sort of our cultures, and you pointed this out, Becky, or the media, good gracious Hollywood, that we don't necessarily get a positive image around aging. And I wondered if you could kind of speak to your own thoughts about that, and we can go in any order. Why do you think it is that, aging is not represented positively in some of these other spaces?
I think we have a lot of ageism in this country. Not every country and culture has ageism, or has as much ageism, I think, as the U.S. does. But the U.S., there is a really big culture of ageism. It's really the only ism that's like publicly acceptable to laugh at still. If you watch any movie or any TV show, it's still completely acceptable to laugh at old people jokes. And that has sort of gone away for other isms that exist out there. But I think that we have a lot of internalized ageism and external ageism, and we haven't really tackled it in the United States. It's something that I think predominates throughout our society, and we could talk about reasons why, but it's there and it's present, and we don't talk about it enough.
I feel as though with the last 10 years or so, as the baby boomers have reached 65 plus, I have noticed that there have been at least some strong efforts to portray older adults as we know them, to be capable, to have lives, to have interests, to engage in things that maybe we didn't think they still engaged in. So it's nice to see, whether it's a show like Grace and Frankie or 80 for Brady or things like that. And I've noticed also, I always watch the Super Bowl to see how many ageist commercials they'll have on. And the ageist commercials have maybe dwindled to maybe one per Super Bowl, where it used to be almost every commercial break, they'd be making fun of older adults. So I'm sensing, just because the target audience perhaps of a lot of these companies with their ads are becoming more and more older adults, the way they're being portrayed, I think, is a more accurate depiction. But it's still just the start, and I feel as though there's a long way to go, but at least there's a little bit of hope that I've been seeing lately, and that's been nice to see.
Yes, great. I would piggyback off both Erin and Chris. In my time at Fromm Institute, I've noticed I've shifted my attitude towards aging because I'm aging, so I guess that happens. But I think culturally as well, it's shifted. There's a different kind of older adult coming to class. Much more active, much more hip, so to say, willing to say yes or no, make decisions. So there's that shift. And I also suspect, I'm not a researcher on this, but I think American culture, kids are told to go to school, graduate, and leave home. Whereas other cultures, not so much, which they're taught to take care of elders or to put them on a shelf, so to speak. And so I think something about American culture is that there's an obsession with beauty and youth that is not sustainable and not realistic. But huge changes are happening.
I'm going to agree with what everyone said. But also for me, growing up, I did see in like the American culture and a lot of the cartoons that we saw that the older you get, the more frail you get, you lose your independence, and that's not true, right? So that's kind of what drives me in my work right now too, is kind of emphasizing we don't lose our independence. We don't have to. We can make these active choices. We could participate in these programs if these programs are accessible to us, and that's where I kind of when you asked that question, that's kind of where my mind went off to, was we can try and say all of these things to change the mindset of the previous generations that getting older isn't bad. It's not bad, but now we need to think about, okay, now what do we do? How are we going to execute all of these things? Like when you said putting the older adults in a shelf, how do we approach that with like the family members, right? So that's just where my thought was going while everyone was answering that.
Well, you could have given me a better segue, because the next question that I wanted to ask each of you was, and this kind of leads into it, is so, as the culture starts to shift to be more accepting, we hear the term about age-friendly environments, and how do we create opportunities to make sure that older individuals or individuals as they're aging are able to continue to, interact and take advantage of the world around them and not be, just shuttered away. So what does an age-friendly environment mean to each of you?
Would you like to speak about, age-friendly university? USF has embraced that?
Sure.
Yeah.
Yes, I would love to talk about it. So there are age-friendly communities, and there are 10 principles behind age-friendly communities. Piggybacking off of age-friendly communities, we've developed this idea of age-friendly universities. And so age-friendly universities exist throughout the world, and USF was approved as the first Jesuit age-friendly university in the entire world. We were approved in 2021 as an age-friendly university, and it basically means that we have assessed ourselves on the 10 principles of an age-friendly university. It doesn't mean that we are perfect on these principles, because we're not, but we assessed ourselves and determined our strengths and our opportunities for growth and areas for collaboration. And it's given us, it largely lives within ICA, but all the members of ICA, we are all really committed to this idea of age-friendly universities and how to further our cause as an age-friendly university. My interest is really in a lot of age-integrated activities. in part because we know that age-integrated activities is actually incredibly beneficial in terms of reducing ageism. And so I think, Becky, when you were talking about how, or Carla, you were talking about how, kids leave the house and they go to school and they get a job and they don't come back and spend time with their families, and you were talking about different cultures. A lot of that is basically age segregation, right? The US is an environment where there's a lot of age segregated activities, and so it's one of the reasons that I love Fromm, because Fromm brings older adults to a traditionally incredibly age segregated place, which is a university. So age-friendly universities, we do a lot of age integrated work to try to reduce ageism and improve opportunities for social interactions. I'll never forget when I was teaching my aging course during the COVID pandemic and we shifted immediately to Zoom classes. I had an event planned where I brought my aging students to an organization off campus that helps older adults stay in the community. And initially we canceled it, and then I went back to them and said, is there a way we can do it on Zoom? I just think it's important. And after that interaction, one of my students reached out to me and said, I really haven't talked to anybody that isn't another student or my boyfriend in about 2 months. And I didn't realize how hard that had been until I had this opportunity to talk to the older adults through SF Village. And so, we often think about these types of age-integrated activities as being beneficial for the older person, but they're actually incredibly beneficial for the younger people too. So,
Well put.
kind of went on a tangent there about age-friendly universities.
And we're working on the Interdisciplinary Committee on Aging on a lot of collaborations. Before this panel, I thought, let me just write down all the collaborations. There's a lot now. Psychology department, kinesiology, your department, nursing, dance department. So when you ask the question, what makes an age-friendly environment? Just doing things together, everyday things together. And even if we construct a class situation, bottom line is they're doing things together, I think. And all those things melt away. Yeah. So creating more opportunities.
I think one of the things that I agree with what everyone was saying. One of the things that I pride in my work is that each district in San Francisco has people call it senior centers, we call it aging and disability resource centers. And that's just a place for seniors to come in, or people living with disabilities to just come in and talk to people. And I feel like that's really important, and it's accessible. We like to emphasize, all the centers are within, I think, 10 feet or a block from a bus line. So that accessibility is really important, because kind of what everyone was saying, that social connection we saw when COVID happened, was just, everyone took a really big hit, and with the work that we were doing, we saw the seniors became even more isolated, more so than before the pandemic, and social isolation was just a really big thing. So just having those interactions, the Fromm, we always tell our clients to go there. They're like, do you have classes? We're like, yeah, here, take these classes. Or we'll have Zumba. Zumba's really big for them right now. Or we'll take them on field trips to farmers markets. It's really, really cool. Or stuff like that, just having those little, I don't want to say programs, activities for them to do has been really fun. We throw them Christmas parties, those are a really big hit because we give out gift certificates. And just opportunities for them to just even talk to the case managers or the specialists have been a really important piece in their daily lives. When one of us calls in sick, they're just like, where are you? Are you okay? And we're just like, yeah, thank you for worrying about us. And just forming those connections have been really, really important.
I'd like to also just make a note that older adults themselves, it's not like we're all just delivering programs that they all need and they're consuming them. And I mean, I have to say, what COVID really revealed to me, I had undergraduate students trying to figure out how to use Zoom. and
It was an
older adults,
equalizer.
whether it's
Yeah.
through the Fromm or through senior centers, or I'm sure IOA programs. And almost to a person, older adults picked up Zoom much more quickly than my undergrad students, because ultimately that was their lifeline to stay connected.
Sure.
They needed that for maintaining social connection, therefore emotional health, and all of those things that go along with it. And it's just wonderful to see such an empowered group of capable, this age cohort that is empowered and is capable and is able to learn things and advocate for themselves. And that really helps to enrich all of these programs where we see interactions amongst different age groups, because the older adults are quite confident in helping to provide their perspective on things to other age groups. And I think that helps to break the ice and just make for a really enriching experience for everybody involved.
As you mentioned that, I was reminded of my mom during COVID and having to learn how to do, the telemedicine, the visit on her iPhone with her provider, and, somebody who, she was very adept at texting beforehand, but not so adept at other issues with like the computer. So to have her, advance to being able to, talk with her provider and stuff, to your point, it's, doing what they need to do and advocating for themselves to make sure that they're able to do that. I bring up health, and I think, as a School of Nursing and Health Professions, we really want to talk with our students about how the healthcare system, the delivery of healthcare, how that does and does not meet the needs of an aging population. And of course, you mentioned earlier, Chris, the baby boomer population. And while some studies show that the baby boomer population is healthier moving into older age than prior generations, they're also living longer, and and now we have multiple older generations, and we've got the very old generations with many different types of chronic illness and things like that. So I'm wondering if you all could kind of share your perspective on how can a health system, and therefore the workforce that supports the health system, how can they create an age-friendly environment to promote health,
To me, it starts with changing a little bit of the paradigm on how future clinicians are trained. There's hardly any focus on anything preventative. Maybe in med school, a student will get one class on nutrition or one class on preventative medicine. Meanwhile, they take multiple courses on pharmacology. So what they know how to do when somebody is presenting with an issue is they know how to prescribe medication. Additionally, the incentive, there's big pharma, but there's not necessarily, big vegetables or big Jarrow.
Big Jarrow.
Big Jarrow. We need some big Jarrow.
That's our next speaker.
And so clearly, I really believe that it's incumbent upon some of our very influential organizations, whether it's AMA and other organizations like that, to really encourage the education of these future clinicians to begin to more widely adopt a lens of prevention and a lens of how behaviors can manage conditions, not only prevent them, but when they do present, it can be managed more effectively. So I'd really love to see that, and I think that's a big step forward that our country and basically every country on earth really needs to take.
I'd like to share something. So we have some students who are taking walks with the kinesiology students, and there are maybe 2 or 3 kinesiology students doing a morning stretch and an afternoon walk. Our Fromm students are pretty resistant, and it's not because they're not active, but it's because they have a schedule. Oh, I already walked. No, I walked from the parking lot to the school, that's enough. Or I'm eating lunch with my friends right now. So there's that barrier, but we get over that. But one Fromm participant who is 80 years old with the kinesiology students commented, he said, when I was growing up, we didn't study kinesiology, we didn't study public health. So he said, what you're doing now, you kids, he said to the USF students, is amazing. That's where it starts. So if students are learning about anatomy, about public health, about how to treat people as a human versus older or younger, then things are going to change. So I just thought that was such a beautiful, reminder that we're all human, really. So I don't know where I just got excited about that. I don't study health per se, but I see it, and yeah, things are changing. I'm hopeful. I am hopeful. But education and programs like this, really.
I agree. As someone who grew up, so I'm a type 1 diabetic, so I'm very familiar with being treated as something that needed to be healed versus someone to be listened to. So that was a really big thing when I used to work one-on-one with clients, with the older adults. They used to just be like, okay, just give it to me. Give me my medicine and then leave. But then I would sit there and be like, what do you want to do, right? That's where the behavior change model, all of that fun stuff that I learned from USF comes in handy. I learned that if we, as the health professions, spoke to them in a way that didn't feel like we were, my client called me their principal at one point. They're like, I don't want to talk to you, you make me feel like I'm a student again because I'm just going to get in trouble because I didn't do what you told me to. And I was like, I'm so sorry, what do you want to do? Little victories here, right? And just showing them that the little victories will inevitably, hopefully make them feel happier and show them that aging is something everyone does, like I'm aging, right? But still, like I keep mentioning, maintaining their independence, and it's their choice, right? That's a really, really big thing, because I feel like a lot of people take away their choice the older people get. I've seen a lot of clients, their kids, unfortunately, take away a lot of their things, a lot of their choices, and you just see them become a shell of themselves. I've seen unfortunately, some home health providers do that as well, like, oh, they can't do that, I'll just do that for them. And what ends up happening is that they lose the ability to do things themselves. So just giving them that autonomy back is a big thing. If we change the way we see them, we change the way we speak to them is a really big thing. And if we change that kind of medical model that we unfortunately kind of unconsciously look at for them, if we change all of that, I feel like that it'd be a lot better.
Yeah, I agree with everything. And to build off what Chris was saying, we don't teach enough about prevention in general, and we also don't teach enough about aging. There's not a ton of content in medical schools and nursing programs, and I would guess kinesiology, I'm not sure, but in most clinically focused disciplines, specifically on older adults and aging. At a previous job, I used to teach one single class on neighborhoods and how neighborhoods affect our health to medical students. And at the end, somebody would invariably say, this is really interesting, but it's not going to be on the boards. And so I can't really pay attention. I have to, study for this other thing instead. And so, until we institutionalize the fact that this is important and you need to pay attention to it, I think we won't have a medical system that is designed really to deal with the needs of older adults. As you mentioned, our oldest baby boomers are nearing 80 at this point. And that's when a lot of people develop significantly more health conditions and concerns. We have this massive number of people getting older, and we're not prepared to deal with it because we haven't institutionalized the importance, I think, in most of our curricula.
Degree.
On that point, what do you think are some of the most significant challenges ahead, in particular for the health system, including the health workforce? But you mentioned that you know, we've got these, the older baby boomers, I mean, we've got waves of people coming now. And so what are some of the biggest challenges you think?
I think the biggest challenge is why we're here, honestly. We have a large demographic shift in our country, and most industrialized high-income countries, our age demographics are getting older, and we don't have the workforce to deal with it. I think that, you know, there are so many different needs within healthcare, from treatment of disease for people who are very sick to enabling people to live in the community and prevent disease, you know, before they ever get sick in the first place. And all along that continuum, we have shortages. We have public health shortages, we have nursing shortages, we have geriatrician shortages. You know, the numbers of geriatricians since 2000 have dramatically decreased, while the numbers of older people have gone up, even though geriatricians apparently have the highest job satisfaction of any medical specialty, but lower reimbursement rates. And so again, that institutionalization, you know, we really need to change those patterns. So I think that's our biggest issue right now, is just thinking about the workforce, thinking about the opportunities that exist, because there really are an enormous number of opportunities for people to work in aging and with older adults, in incredibly satisfying work with a really amazing population of people. It's just getting people to choose to go into it.
I would agree with that. And also, I mean, the economics of aging in our society getting really concerning. Eventually, there's going to be a ratio of working to older adults that just is going to create issues with Medicare and with Social Security, and those are big, huge economic issues that are looming over our country and haven't really been dealt with yet. And it's kind of a hot potato. Nobody wants to take it on because they know that will kind of label them, but it's an issue that we can't just kick down the road forever. Some solutions need to come along, and I think one of the major solutions that will help to integrate whatever the changing finances are will be that focus on prevention, and the fact that, you know, we can actually do a lot to reduce the costs of ourselves or family members, people in our community, by having systems in place, programs in place, education in place for what we're already seeing, a more well sort of prepared cohort of people going into older age. I'm hopeful that will just continue to, we'll see progress on that front as well.
And I'm just wondering, with more preventative care, then the older population is going to be more able, hopefully, that's the goal. So hopefully more integrated, and so my ideal is that will sufficiently start dropping a gap between older and younger. I'm hopeful that, and I see it at the Fromm Institute, actually. But there's so many economic concerns, especially living in the city. I mean, no matter what age you are, right? So I suspect older adults will be working longer, possibly volunteering longer. So how do we take care of that and maybe integrate them into programs like we're doing at USF?
I'm just going to piggyback off of what you're saying, because one of the main things that my team does is help the older population sign up for these benefits, find housing and all of that. And especially in the city, unfortunately, the reality is there's not enough resources, there's not enough housing, there's a lot of paperwork for one benefit, and then at the end of like a week of just trying to fill out the application, you find out that they don't qualify, right? And just trying to keep the morale of my team basically up. So my team, we started with 11 people, then we grew to 25. But I have a rotating door of people leaving because they're just, I don't want to say burning out, they're getting disheartened by the way the climate is for older adults and the paperwork they have to fill when they retire. what insurance they qualify for now, do they pay out of pocket, and then you see all of these things and you're like, we could apply for this housing for you, but you can't make the monthly payments, so now we have to apply this program for you to do this, this, and this, and just the whole checklist gets super overwhelming. And I kind of understand why a lot of my coworkers end up leaving, because it's just all this work you put in, you don't see the progress, right? But it's also like educating the new students coming in, like, this is what we need to do, because no one teaches us how to apply for these programs, right? You could ask the city, the state to do all these kinds of trainings, you'll never get them, unfortunately. And it's just trying to figure out how to navigate this with the older adults, and trying to make sure that what you're doing, you see, even if you don't see the positive outcome that you want, you're still helping. And that's what I like to tell, like, people who get interested in this older adults field. They're like, why do you do this? Because it makes me feel happy. And I want to show you that why it makes me feel happy, even though we don't automatically see it. The senior or the older adults, they feel important. They see that they're not just something to be pushed aside like some movies say that they should be. And yeah, I kind of rattled off a little there, but yeah.
No, 'cause my next question was going to be, you know, what would you tell, you know, individuals who were thinking about going into working with the, you know, the aging, you know, in various capacities. So you started that. So is there anything else that you would tell? Like, why should somebody choose a career in working with aging?
Because you will learn a lot. You'll be surprised at what you learn, whether that's navigating the red tape of like government policies, or if like you can kind of make accommodations for your home, for your aging loved ones. And there's a lot of little knowledge nuggets that you can find in this field. Finding that niche in this field is also a bonus. Like, I learned I like doing outreach for the seniors and talking to them a lot. I used to hate talking, but I found that working in this field. And I know a lot of my friends, they ended up going into nursing for older adults because they like having that like bond with them. The bond that they have is a little different from what they tell me, because for some reason we have these conversations all the time. I don't know why. And just like I'm gonna keep saying, you're just gonna keep learning with this population. You will never know what, but at least you'll learn something, and that's always a positive, right?
I think for me, it's a no-brainer. Like, it's just so rewarding to work with people on a very authentic, honest level. And I think with older adults, sometimes there's manipulation and trauma, and people have been through stuff. But for the most part, it's very authentic, and you'll get there. And for me, that's one of the highest values in life, is to be your authentic self. And if we can provide more and more of that, it's just, that's why we live. Why not? Why else? Education, wonderful conversations with people, getting help. To me, that's just like, that's life. That's why I chose it.
Well, being a kinesiology professor, most of our students are coming into the field through a similar path that I followed. They were young, they were active, they were involved with athletics, maybe they got injured and had to have rehabilitation on injuries they had. Perhaps they just find the human body to be really fascinating and want to understand how it works better. But almost none of them come at it from a perspective that, hey, I'm going to work with older adults someday. I want to like learn about all these ways I can help people age. The reality that I try to first introduce to them is, you know, where are the numbers? And fortunately, San Francisco has the 49ers. I tell them, you're probably going to work with the 79ers. It's just the numbers. That's how it's going to work out. And then it's important to provide them experiences where they can see how beneficial that is. So get them into the gerontology minor, where they get experiences, not just learning about the physical and biological aspects of aging, the psychological aspects of aging, involving them with seeing older adults in a dance group, seeing older adults at the Fromm, learning things and being intellectually curious at this age, getting them involved with research that I do or I collaborate with other people doing, where they can see older adults making progress and really wanting to improve their quality of life. Get them out into the community, working in senior centers where programs like Always Active are delivering physical activity programs. And hopefully that kind of message to think about working with the 79ers is then reinforced by positive experiences that they have. So USF, just having a Gero minor here, we established it back in 2005, and continuing to thrive, the university having a service-driven mission, and it's a perfect fit. And I really feel like USF provides a lens and an opportunity through which students can really see a really positive and happy and fulfilling future working with this age group. So.
Yeah, I agree. I think that I would tell people a few different things, building on what you all have already said. But one is that it's personally incredibly fulfilling and rewarding. It's just a really dynamic, interesting population of people. During one of my crossovers in my Aging and Public Health class, I do a peer mentoring session with a group off campus of older adults living in the community. And after that would happen, every single semester somebody would say something like, "Can you believe that I talked to somebody who started the first AIDS hospice in San Francisco?" And I would say, sure, these people have done incredible things in their lives. Like, yes, they have lived very interesting, dynamic lives. You will be working with this interesting, dynamic population. Who could ask for anything more? It is life-changing. We had, with Fromm, we did a mentoring session with our undergrad public health students last semester, and that is the term that one of our students used for the mentoring session. She said, "It changed my life." And so there is so much learning to be done, that you will continue to learn when you work with older adults. And there's job security here. I mean, this is where our population demographic is going. There are jobs. If you want to work in it from a clinical perspective, if you want to work in it from a preventive perspective, if you want to work in it from a programming perspective, there are jobs, and there will be more and more and more jobs as we continue to age as a country.
If I may, I wanted
Yes,
just
please.
what I was thinking, one more thing I wanted to say is that working with another population, you see it all the way through. You don't just see, oh, I'm going to get a job, I'm going to get paid money, I'm going to have a nice house, but you get to see life all the way through and see life happy at the end, thriving and excited about things and experience. And that is the wealth of it all. That's the secret sauce. So I wish if we could say to students, to make it sexy, you're going to somehow, that's the secret sauce. See what death or getting close to death is really like. Because it's really awesome. It can be, and it also can be challenging, but and we need to see that as a culture.
I don't know that I have anything more to say. What a wonderful sentiment to end this panel on is to really value the aging process. And I think, being able to ensure that our students understand that is an opportunity that working in this career field can give them. I want to thank each of you tonight for your time and sharing your wisdom and your experience about working with this unique population. that isn't so unique, that are demographics, but special population. And thank you so much for sharing your experiences and your knowledge. Really appreciate it. I know I learned a lot tonight just in thinking about it. So thank you so much.
Thanks for having us.
And thank
What a
you all
great
for joining us.
opportunity.
Yeah.
Big Jero.
Yes, that's the secret.
That's good.
Yeah, we're gonna start
It's so
it.
nice to meet you. We really need that.
Yes.
Yes, this is great.
Yeah.
We need a campaign, like first 5 is gonna be the last 10 or something.
Yeah.
There you go.
Yeah.
So
Some branding, we need some branding.
Branding.
Yeah,
Yeah.
Branding.
Well, I was gonna ask you guys what would be your
Yeah.
policy thing, but you ended on such a
Awesome.
lovely note. I didn't wanna disrupt that, but, you know, just, you know, besides the branding, but you bring up a really important point. I mean, that's how we were able to, from early childhood, it was that message about the importance of the first 5 years. You know, we need something similar for the other end of the spectrum, you know.
You have to see it all the way through if
Yeah.
possible. But
Yeah.
when we're younger, we have hormones and, you know, all the things that cloud that, but.
There are great initiatives going. I mean, there's an organization called Growing Bolder, and it focuses specifically on spotlighting older adults who are doing amazing things, whether it's intellectual things or physical things or social things, and just kind of making it more
Sexy.
yeah, kind of perspective
But
that
yeah, it is.
things are possible. And
Yeah.
certainly, I mean, we can't ignore the reality that also something or some things will likely happen to us where we'll either have to try to overcome them or we'll have to live with them and perhaps can kind of be part of the ending to our lives. But even people at the very end of life, I've been around a lot of that in
Yeah.
the last several years, and it's less scary, depressing, and more reflective than I ever kind of perceived when I was younger for an experience like that to be, and just says a lot about just what the human experience is.
Right.
So, yeah.
I think, so I was involved in some palliative care work, so I worked at it on the child side of things, but because of just thinking about how we do palliative care and hospice and stuff, one of the things that I always found so interesting and just so meaningful were the efforts to do the life stories, you know, and just to give people an opportunity for themselves to reflect on their own life and what a healing process that is, and what just a special process that is as people are moving towards, you know, the end of life.
And it's so important for the people who are left behind
Right.
too. You know, so often these stories get lost to history, and
Yeah.
people don't really know their own oral histories and their families. But in a class that I taught when I was in grad school, and then I carried it into like my current aging class, I always had students do an interview with an older adult, and almost always within a year somebody would approach me and say, you know, I interviewed my aunt, she ended up passing, and you know, my mom is so grateful that I have that recording of our interview. You know, it means so much. It's important for the older person, it's also important for the people who are left.
Young people, we need to make a living and we need to survive, but what I found is that what makes me happy is much more than that, and that is the human connections and having I think you mentioned it in your notes, all the things, the education, the physical space, physical health, mental health, and then some kind of spiritual connection. And that can be fine-tuned, and I think it can be with older adults if you have an experience early on, then the rest of your life is so much more.
please. We have some food to fill you up before you leave tonight, so, but thank you so much.
Thank you.
Thank you.
That was, thank you. It was just such
So
a.
satisfying.
Yeah, really an interesting conversation. I think we need to do more of this.